Pelvic trauma. What you need to know. What is pelvic trauma? Pelvic trauma is a physical injury to the pelvic bone, often causing a fracture to its structure. This comprises of the hip bones, tailbone, and sacrum. The process. After arriving to the accident and emergency department, the patient will be registered at the reception and triaged by the triage nurse. The first line of imaging modalities that is used in assessing pelvic trauma is an X-ray. If the X-ray shows a break of the bony structure and internal bleeding or trauma is suspected, then the patient will have an angiograph and a CT performed. If bleeding or trauma is found, then the patient will be brought to theatre to stop this injury. After this has occurred, the fracture of the pelvis will be operated on. Due to the urgent nature of pelvic trauma, you may not see the patient throughout this process, but the accident and emergency department will keep you updated on their condition. Why are these tests being performed? These tests are being performed on the patient to ensure that the patient will receive the best and most efficient treatment for the injury that they may have. The tests diagnose specific injuries that would otherwise go unnoticed and could lead to complications. What is an X-ray? X-rays are electromagnetic rays, similar to normal rays of light, but with higher energy. Different parts of the body absorb a certain amount of these rays depending on the density of the body part. The difference in absorption is evident on the X-ray image, with the most dense structures like the bones appearing white and the least dense structures appearing black. This allows the radiologist to find fractures in the pelvis. How is the exam performed? The patient may be undressed and a hospital gown will be put on to expose the area being examined. The patient will be positioned to ensure that the radiographer will get the clearest image possible. This usually will require the patient to lie on an examination table. 2 X-rays will be taken to see the pelvis from the best angles. What is an angiogram? An angiogram is an X-ray of blood vessels after a contrast agent has been taken, allowing the blood vessels to be seen on the X-ray image. Why is an angiogram suitable? Angiograms are used for pelvic trauma patients who have had internal bleeding as a result of a pelvic fracture because they are used to perform embolizations. An embolization is the deliberate blocking of a blood vessel to stop bleeding. Angiography and embolization are suitable because they can be used to identify and control arterial hemorrhages, are 85 to 100% effective, are considered safe with minimal infection risk, and avoid surgery so are not invasive. What is a CT? A CT is the creation of a 3-dimensional picture. It is created by using multiple X-rays to produce a clear image of the inside of the body. The CT scanner is a large donut-shaped machine with an examination table that slides in and out of the tunnel. Why is the CT suitable? It is suitable in emergency situations such as this situation to help identify internal injuries, particularly soft tissue injuries. It is fast, accurate, non-invasive and painless. What should I know about the exam? The CT takes 15 to 30 minutes, depending on if contrast is used. If internal bleeding is suspected, contrast may be used to identify where this is occurring from. This consists of a barium or iodine contrast being injected through a cannula in the arm. How does it happen? For scans requiring IV contrast, an IV line will be inserted into one of the patient's veins. A radiographer will bring the patient into the CT room and position the patient comfortably on the table. Pillows or straps may be used to help the patient lie in the specific position. Most often, the patient will be asked to lie flat on their back with their arms over their head. The radiographer will leave the scan room during the examination and move to the control room. The radiographer will always be able to see and hear the patient during the exam. The radiographer will move the table into the CT machine, which looks like a giant donut made of plastic and metal. The table the patient is on will slide into the scanner. The scanner is open at the back and the front, allowing the patient to see out. While the table moves the patient into the scanner, detectors on the X-ray tube rotate around them. Each rotation yields several images of thin slices of the body. The patient may hear buzzing noises. The table will move a few millimeters at a time until the exam is finished. The patient will be asked to drink water after the exam if contrast is used, to ensure that the patient flushes the contrast out of their system, as there is a chance that it could cause kidney damage. After a round of scans, the patient may be required to wait while the radiographer reviews the images to make sure they're clear enough for the doctor to read. What should the doctor be told? Please tell the doctor as much history as you can recall about the patient, particularly if the patient cannot give an accurate history themselves, as this can help the doctor in the treatment of the patient. If you were present at the time the patient sustained the injury, please provide any relevant details, as this may guide the doctors in their examination. If the patient is pregnant, please inform the doctor or radiographer. There is a small chance that the radiation could cause an abnormality in the developing fetus. It is important to inform the doctor if the patient has any known allergies, or if the patient has had a previous reaction to contrast. Inform the doctor if the patient has had any kidney problems, or has asthma, as this may alter what type of test the patient may have. Please inform the doctor of any medication that the patient is taking. What happens next? A radiologist will review the scans after they are taken to assess for internal injuries and for fractures. If there are internal injuries, the patient will be brought into surgery to repair the internal damage before the fracture is operated on. The team of doctors in the accident and emergency department will keep you updated on the patient throughout the process.